Lucy Eletel, a fourth-year medical student at the Burnett Marion School of Medicine at Texas Christian University, is turning her passion for patient care into research.
Or out-of-hospital births associated with adverse health outcomes and increased healthcare utilization.
She's hoping her research could add valuable insight into finding solutions for Fort Worth's high mortality and morbidity rates among women and infants.
Then I realized how big of an issue this was in Tarrant County, and when I had spoken to Dr. Riley, I noticed that this was a passion of his as well.
Lucy has teamed up with Dr. David Riley, an assistant professor at the Burnett School of Medicine at TCU, and a neonatologist.
It's probably better just to emphasize that we're actively, monitoring this in real time.
Dr. Riley specializes in treating infants after birth who may be born with congenital issues, birth complications, or trauma that would require them to be admitted into the intensive care unit.
We have the added complexity sometimes if the infants are transferred here from outlying facilities that we often don't have the immediate face-to-face interaction. The mom might be sick in a hospital 30 or 100 miles away, and we're taking care of the baby and having to, make phone calls and trying to update them.
1% of births are not born in a hospital. It could either be home birth, birthing center, or, car ambulance kind of emergency situation.
Lucy dedicated her 4-year scholarly pursuit and thesis research project to finding out if women delivering babies outside of the traditional hospital setting at birthing centers and at-home child deliveries could have better outcomes if a standard of care like hospitals have is put into place. Hospitals in Tarrant County follow guidelines from the American College of Obstetrics and Gynecologists and the American Academy of Pediatrics for delivery and care of newborns.
It's important to get all the facts in order to have a standardized approach to the research, because if some birthing centers or some home birth midwives are approaching those things differently, that can ultimately affect the data.
Lucy's research has a two-pronged approach. First, with Dr. Riley's help, she's been able to look at data from Cook Children's Neonatal Intensive Care Unit from 2019 through 2024 to see what percentage of infants admitted into the ICU were delivered at birthing centers or were at-home deliveries experiencing complications.
Preliminary look that we've had on the data certainly shows that the infants that come to our care from those facilities have a very high burden of disease. We don't really have a good sense of how many babies are being delivered in this situation. We only see the ones that come to us.
Next, she will work with 8 birthing centers in Tarrant County to collect data about their standard of care during deliveries.
But ultimately, it's not going to get done to lower that infant mortality rate if just one birthing center or one hospital is in on it. It's important to get the whole community working on it together, I think, is ultimately how we're going to make the most change.
And Lucy isn't tackling this problem alone. There are 5 other medical students who have dedicated their 4-year research projects to finding answers to the mortality and morbidity problems for women and infants in North Texas.
The research our students are doing dovetails beautifully.
Separate from the students' research, the Burnett School of Medicine at TCU and UT Southwestern Medical Center launched the North Texas Maternal Health Accelerator with help from Fort Worth Mayor Maddie Parker and a Child Poverty Action Lab with $25 million in funding to help solve morbidity issues for women and infants in North Texas through research and providing moms with more resources.
We're charged, we're challenged, and we've grown up to see a problem and then to try to make it better. And that's what we're doing in Fort Worth, and that's quite frankly what we're doing in North Texas.
I think it's really awesome that there's so many people joining together to address and tackle this issue together. And then for me, this kind of just helps fuel my day-to-day of why I'm doing this.